I am Dr. Laura Moreno, and in this video, I want to talk to you about something that frustrates thousands of people every single day, something that makes you feel uncomfortable in your own clothes, something that makes you look in the mirror at night and wonder how your stomach could look so different from the morning. I want to talk to you about abdominal bloating, that persistent swelling that makes your belly feel tight, heavy, full of air, even when you haven't eaten much or when you think you're eating healthy. Many people automatically assume it's fat. They think they are gaining weight fast or that their metabolism is broken, but here's the truth that most diets never explain. Real fat does not appear in a few hours. Fat doesn't make your abdomen flat in the morning and distended by evening. That rapid change is not fat. It's inflammation, gas, fluid retention, and slow digestion. And this is where the medical secret comes in. When we address the real causes inside the gut, bloating can improve dramatically in just 72 hours. Not months, not extreme diets, not starvation, just correcting how your digestive system functions. I see this every day in my patients. People who have tried cutting carbs, skipping meals, drinking detox teas, buying expensive supplements, following restrictive plans, and still feel swollen all the time. They blame themselves, thinking they lack discipline. But the problem is usually not willpower, it's physiology. Your abdomen is not just a storage space for food. Inside, you have a highly complex digestive system filled with nerves, hormones, immune cells, and trillions of bacteria that form what we call the gut microbiota. This ecosystem controls how you digest food, how you absorb nutrients, how much gas is produced, how inflamed your intestines become, and even how your immune system behaves. When this system is balanced, digestion feels almost effortless. You eat and feel light. But when it's disrupted, food ferments excessively, gas accumulates, the intestinal walls become irritated, fluids are retained, and your belly expands like a balloon. So, two people can eat the exact same meal, and one feels fine while the other looks 6 months pregnant by the end of the day. The difference is not calories, it's gut health. Think of your intestines like a highway. When traffic flows smoothly, everything moves forward. But if there's a blockage, cars pile up. Inside your body, when food moves too slowly, bacteria have more time to ferment it. Fermentation creates gas. Gas creates pressure. Pressure creates bloating and discomfort. One of the biggest triggers I see is ultra-processed food. Packaged snacks, sugary drinks, refined flours, artificial sweeteners, preservatives. These substances don't just add calories. They directly irritate the gut lining and feed the wrong types of bacteria. Over time, your microbiota becomes unbalanced, favoring inflammatory strains instead of protective ones. When that happens, even normal foods can cause symptoms. Your body becomes reactive. You start saying things like, "Everything makes me bloated," when in reality, your gut has lost its tolerance. Another powerful factor is stress. This is something many people underestimate. When you're anxious, rushed, or constantly multitasking, your nervous system switches into survival mode. Blood flow is redirected away from digestion and toward muscles and the brain. Your stomach produces fewer digestive enzymes. Your intestines slow down. Food sits longer than it should. This delay alone can create hours of heaviness and swelling. And it's very common today. Eating while working, scrolling on your phone, driving, or arguing. Your body doesn't interpret that as a safe moment to digest. It interprets it as danger, and digestion shuts down. Constipation is another silent contributor. If you're not having regular bowel movements, waste remains inside your colon longer than it should. The longer it stays, the more bacteria ferment it. The more fermentation, the more gas and inflammation. It's like leaving trash inside your house for days. Eventually, everything smells and swells. This is why daily elimination is not optional. It's a basic requirement for a flat, comfortable abdomen. Food intolerances also play a role. Some people don't properly digest lactose, gluten, or certain carbohydrates known as FODMAPs. These substances are poorly absorbed and become fuel for bacteria, which then produce large amounts of gas. You may not have a true allergy, but your body still reacts with bloating, cramps, or noise in your stomach. Hormones matter too, especially in women. During certain phases of the menstrual cycle, progesterone slows intestinal movement and increases fluid retention. That's why many women feel more swollen before their period. It's not weight gain, it's physiology. Now, here's the key message I want you to understand. If bloating is mainly inflammation, gas, and retention, then reducing those three things quickly can change how your abdomen looks and feels within days. That's the foundation of the 72-hour approach I use with many patients. The first step is calming the gut. For a short period, we reduce foods that are difficult to digest, not forever, just temporarily. Heavy fried foods, ultra-processed snacks, excessive sugar, carbonated drinks, and large late-night meals tend to overload digestion. Giving your intestines a break allows inflammation to settle. The second step is hydration. Many people drink far less water than they think. Dehydration slows bowel movements and increases water retention paradoxically. When your body senses low fluid intake, it holds on to every drop. Drinking adequate water actually helps release excess fluid and improves intestinal motility. The third step is restoring movement. Your intestines are muscles. They need activity. Something as simple as walking for 10 to 15 minutes after meals can stimulate peristalsis, helping food move forward and reducing gas buildup. This is one of the simplest and most underrated medical tools. The fourth step is supporting your microbiota. Fermented foods like yogurt with live cultures, kefir, or other natural probiotics can help reintroduce beneficial bacteria. Fiber from vegetables feeds those bacteria so they can produce anti-inflammatory compounds that protect your gut lining. And finally, there's something that almost nobody talks about. How you eat matters as much as what you eat. Eating slowly, chewing thoroughly, sitting down calmly, and allowing your body to relax before meals can dramatically change digestion. When your nervous system feels safe, your stomach produces more acid and enzymes, and food is broken down properly instead of fermenting later. These small behaviors may sound simple, but together they create powerful physiological changes. Within 1 day, gas production decreases. Within 2 days, bowel movements improve. Within 3 days, inflammation drops and fluid retention lessens. That's when people suddenly say, "My belly feels lighter," or "My pants fit better already." And that's the moment they realize it was never about starving themselves. It was about helping their body function the way it was designed to. Because your body is not your enemy. Your abdomen is not trying to sabotage you. Most of the time, it's just sending signals, asking for better digestion, better rhythm, better care. When you listen and respond correctly, the results can appear much faster than you ever expected. And that's exactly why understanding these mechanisms is far more effective than chasing the next trendy diet or miracle product. Because once you learn how to calm inflammation, support your gut bacteria, improve intestinal movement, and create the right internal environment, you start to notice changes not only in how your abdomen looks, but in your energy, your mood, your sleep, and even your mental clarity. And this is where the real transformation begins. Because a healthy gut doesn't just give you a flatter stomach, it changes how your entire body functions. And once you experience that difference, you start paying attention to signals you used to ignore, signals that your digestive system has probably been sending you for years, quietly asking for help. Because those signals are rarely dramatic at first. They don't usually show up as severe pain or an emergency. They show up as small, everyday discomforts that people normalize. Feeling heavy after every meal, unbuttoning your jeans at night, excessive burping, gas that seems embarrassing or uncontrollable, a belly that feels hard instead of soft, waking up tired even after sleeping enough, cravings for sugar or carbs that you can't explain. These are not random annoyances. They are messages from your gut. One of the most important things I teach my patients is that bloating is often the earliest sign of intestinal inflammation. Before disease appears on a scan or a lab test, the body whispers. And bloating is one of those whispers. When your intestinal lining becomes irritated, even slightly, it starts to react more strongly to normal foods. The wall of the intestine can become more permeable, something we sometimes refer to as leaky gut. Tiny particles that shouldn't cross into your bloodstream start slipping through. Your immune system notices and responds with low-grade inflammation. That inflammation doesn't just stay in the gut, it spreads systemically. So suddenly, you're not only bloated, you're tired, foggy. Maybe your skin breaks out more easily. Maybe you feel achy or swollen in your hands. All of this can start with an unhappy intestine. And here's the problem. Most people try to solve this by eating less. They skip meals. They cut entire food groups. They drink only coffee for breakfast. They punish their body. But eating less doesn't fix poor digestion. Sometimes it makes it worse. When you undereat, your metabolism slows, your stress hormones increase, and your gut motility decreases even more. Food stays longer in the intestines, fermentation increases, and bloating actually gets worse. So you feel stuck. You eat and bloat. You don't eat and still bloat. That's when frustration sets in. This is exactly why the 72-hour strategy focuses on function, not restriction. We don't starve the body, we support it. For example, one simple medical tool that works surprisingly fast is regulating meal timing. Your digestive system loves rhythm. When you eat at completely random hours every day, your gut never knows when to prepare enzymes or acid. But when meals are more predictable, your body anticipates digestion and performs better. It's like training your body on a schedule. Another powerful but overlooked factor is chewing. It sounds almost too basic, but digestion begins in your mouth. If you swallow large pieces of food quickly, your stomach has to work much harder. Poorly broken down food reaches the intestines, where bacteria ferment it aggressively, producing gas. When you chew thoroughly, you're mechanically pre-digesting food. You reduce the workload downstream, less fermentation, less bloating. Something as simple as slowing down and chewing each bite properly can cut symptoms dramatically in just a couple of days. Posture also matters more than you think. Sitting hunched over compresses your abdomen and slows the natural movement of your intestines. After meals, staying slightly upright or going for a gentle walk helps gravity assist digestion. Lying down immediately after eating traps gas and delays emptying. Your body was designed to move after meals, not collapse onto a couch. Sleep plays another crucial role. Poor sleep increases cortisol, your stress hormone. High cortisol promotes fluid retention and inflammation and disrupts the balance of gut bacteria. That's why people who sleep badly often wake up already feeling swollen. Sometimes improving sleep alone reduces bloating noticeably within a few days. Your body repairs itself at night, including your intestinal lining. Without proper rest, that repair never happens. Now let's talk about something many people don't associate with their belly at all: breathing. Most adults breathe shallowly, only using the upper chest. But your diaphragm, the large muscle under your lungs, actually massages your intestines when you breathe deeply. With every full breath, it gently stimulates intestinal movement. Shallow breathing means less internal massage, slower transit, more stagnation. Deep, diaphragmatic breathing, even for 5 minutes a day, can improve motility and reduce that trapped, gassy sensation. It sounds simple, but physiologically it makes perfect sense. When we combine all these elements together, hydration, gentle foods, movement, proper chewing, regular timing, stress control, good sleep, and deep breathing, the gut environment changes rapidly. Inflammation begins to decrease, gas production drops, waste moves more efficiently, excess fluid is released. And this is why many people look in the mirror after 2 or 3 days and say, "My stomach looks flatter already, I feel lighter." Not because they lost fat, because their body stopped fighting itself. This is what I mean by the medical secret. It's not a pill, it's not a miracle herb, it's understanding physiology and working with it instead of against it. Your body already knows how to maintain a comfortable, flat abdomen. You just have to remove the obstacles. And once you experience that difference, something shifts mentally too. You stop chasing extreme diets. You stop blaming yourself. You start listening to your body with more respect. Because the goal isn't to have a perfectly flat stomach every minute of the day. The goal is comfort, lightness, normal digestion, feeling at home inside your own body. And when you reach that point, you realize that bloating was never a life sentence. It was simply your body asking for small, consistent changes. Small adjustments that, when applied correctly and patiently, begin to transform not only your abdomen but your overall health, setting the stage for deeper healing and helping you understand that sometimes the most powerful medical solutions are not the most complicated ones, but the ones that bring your body back to its natural balance. Because once that balance begins to return, something interesting happens that many of my patients never expect. The changes are not only physical, they are emotional and mental too. When your abdomen is constantly swollen, tight, or uncomfortable, your brain interprets that as stress. Your nervous system stays slightly on alert all day. You become more irritable, less patient, more fatigued. You may not even connect it to your gut, but there is a direct line of communication between your intestines and your brain. We call it the gut-brain axis. Nearly 90% of your serotonin, the neurotransmitter that regulates mood and well-being, is produced in your gut. So when your digestive system is inflamed or imbalanced, your mood often suffers too. This is why people with chronic bloating frequently say things like, "I don't feel like myself," or "I feel heavy, slow, or unmotivated." It's not laziness, it's biology. When we reduce inflammation and improve digestion, mood often improves within days. Energy rises, mental clarity returns. People wake up lighter, not just in their belly, but in their mind. And that's when the 72-hour reset becomes powerful, because it creates momentum, it gives you proof. It shows you that your body can respond quickly when you treat it correctly. Now, let me explain another piece that almost nobody talks about: hidden food sensitivities. These are not dramatic allergies. You're not going to break out in hives or stop breathing. These are subtle intolerances that create low-grade inflammation and gas over time. Foods like excessive dairy, ultra-processed wheat products, artificial sweeteners, carbonated drinks, and certain gums or additives commonly found in diet foods. Ironically, many people switch to light or sugar-free products to lose weight, but these products often contain sugar alcohols or artificial compounds that ferment heavily in the gut. They pull water into the intestines and create even more bloating. So someone drinks a diet soda thinking they're helping themselves, and a few hours later, their stomach looks twice as big. It's not fat, it's chemistry. During the 72 hours, removing these irritants gives your gut a chance to calm down. Think of it like removing noise from a room so you can finally hear clearly. When you reduce triggers, your body doesn't have to defend itself constantly. Another common culprit is eating too fast while stressed. When you're anxious, your body activates the sympathetic nervous system, the fight or flight response. Blood flow is diverted away from digestion. Enzyme production drops. Stomach acid decreases. In other words, you physically cannot digest food properly when you're stressed. But many people eat lunch while answering emails, scrolling on their phone, arguing, or rushing. Their body is in survival mode, not digestive mode. And then they wonder why they feel bloated. Something as simple as sitting down, putting your phone away, and eating calmly can dramatically change how your body processes food. Digestion requires presence. Your body interprets safety as permission to digest. And there's one more factor I always emphasize: water balance. Most people think bloating means they should drink less water. That's a mistake. Dehydration actually makes you retain more fluid. Your body holds on to every drop because it thinks water is scarce. Proper hydration helps your kidneys flush excess sodium, reduces water retention, and supports regular bowel movements. When you're well hydrated, waste moves out more efficiently. Less stagnation, less pressure, less swelling. So paradoxically, drinking enough water makes you look less puffy, not more. When you put all these pieces together, you start to understand something important. Bloating is rarely about one single cause. It's the accumulation of small daily habits, tiny stresses, minor irritations, poor timing, low movement, inadequate rest. Each one adds a little burden, and eventually your gut says, "I can't keep up." But the good news is that the opposite is also true. Small positive habits accumulate too. Each good decision removes a little burden, and suddenly your body can breathe again. This is why you don't need extreme detoxes or expensive supplements. Your liver and kidneys already detox you every second. Your intestines already know how to function. They just need support. Over the years, I've seen patients spend hundreds or thousands of dollars chasing miracle solutions. Fancy powders, strict elimination diets, complicated programs, and yet the most dramatic improvements often come from the simplest changes: eating whole foods, chewing slowly, walking daily, sleeping well, drinking enough water, managing stress. It's almost boring, but boring works. Medicine is often less glamorous than social media promises. Real healing is consistent, gentle, and repetitive. It's not dramatic, it's sustainable. And when you truly internalize that, something shifts. You stop looking for hacks. You start respecting your biology. You begin to trust that your body is not broken. It's communicating. Every time you feel bloated, it's not your body betraying you. It's your body asking for attention. And when you respond correctly, when you give it what it actually needs instead of fighting it, the transformation can feel almost effortless. Your clothes fit better, your energy improves, your face looks less puffy, your digestion becomes predictable. You stop fearing meals, you stop obsessing over your stomach, you simply live. And that freedom, that sense of lightness and comfort, is what I truly want for you. Not perfection, not an unrealistic flat stomach 24 hours a day. Just a calm, healthy abdomen that lets you forget it's even there. Because when your gut is quiet, you can finally focus on everything else that matters in your life. And that's when you realize that the real secret was never about restriction or punishment, but about understanding, patience, and learning to work with your body instead of constantly fighting against it. So, if there's one idea I want you to remember after everything we've talked about, it's this: abdominal bloating is not your enemy, it's information. It's your body sending you signals that you're eating too fast, signals that stress is too high, signals that certain foods don't sit well with you, signals that your gut bacteria need balance, signals that your digestive system needs support, not punishment. And once you stop ignoring those signals, once you stop masking them with antacids, laxatives, or extreme diets, and you start listening instead, things change faster than you think. In just 72 hours, you can begin to feel lighter. Less pressure, less gas, less swelling, your abdomen softer in the morning, your clothes fitting better by the afternoon, your energy more stable, your mind clearer, not because of a miracle, but because physiology works. When inflammation drops, fluid retention drops. When digestion improves, gas decreases. When your microbiome stabilizes, fermentation calms down. When stress lowers, your intestines finally relax. Your body already knows how to heal. You just have to stop getting in its way. I've seen it over and over again in clinic. People who believed they had slow metabolism, or thought they were gaining fat overnight, or felt permanently distended after every meal. Many of them weren't dealing with fat at all. They were dealing with inflammation, poor digestion, and daily habits that quietly sabotaged their gut. And once we corrected those habits, their body responded almost immediately. That's why I encourage you to think of this not as a temporary fix, but as a reset, a starting point. 72 hours to show your body what balance feels like again. From there, you don't go back to old patterns. You build on what worked. You keep choosing real food. You keep moving every day. You keep hydrating. You keep managing stress. You keep eating slowly and mindfully. You keep respecting your sleep. Simple things, repeated consistently. Because health is not created by extreme actions, it's created by small decisions made daily. And when your gut feels good, everything feels easier. You wake up more comfortable. You think more clearly. You move more confidently. You stop planning your day around discomfort or hiding your stomach. You feel like yourself again. So if you've been struggling with bloating for months or even years, don't lose hope. Your body isn't broken, it's just overwhelmed. Give it a little care, a little patience, and the right conditions, and you might be surprised at how quickly it responds. Start today. Try the 72-hour reset. Listen to your body. Pay attention to how you feel. Because sometimes the most powerful medical secrets aren't complicated at all. They're simply about giving your body the chance to do what it was designed to do all along.